California is different. That's our superpower. We're the state where big ideas take off, with discoveries and technology, from music to movies to movements. What if we all came together to envision our long-term future, where everyone is given the opportunity to succeed, where all of our neighborhoods are healthy and strong? We are California 100. We engage communities from every corner of the state to design a better future. We are students and parents, researchers and organizers, entrepreneurs and policymakers. And we are harnessing the state's immense talent with dozens of research and innovation projects to ensure California's leadership well into the next century. We can do this. After all, we are the Golden State, a place of dreamers and doers. So come join us. Let's think big and different. Let's create the next 100 years, starting today.
Everyone, my name is Karthik Ramakrishnan, and I'm the Executive Director of California 100. On behalf of our staff, our commission, our research partners, and advisors, thank you for joining us today. We're thrilled to have you here, either in person here in Los Angeles or online throughout California and elsewhere. Now, many of you have been following us ever since we got started, ever since we announced our research partnerships in July of last year. I'm so thrilled here that less than a year later, we have a massive amount of research that is coming out thanks to the tremendous work of our research partners. Let me just say a little bit about California 100. California 100 envisions a future that is innovative, sustainable, and equitable for all Californians. Our mission is to strengthen the state's ability to collectively solve our research partnership, to collectively solve our problems and to shape our long-term future. Through research, as we'll see today, through policy innovation, through advanced technology and engagement. And we do this not on our own, but by identifying, mobilizing, and supporting champions for change throughout the state. Key to our work is engaging young Californians, and I'm so thrilled to announce that we now have a place on our webpage, if you go to california100.org/youth, where we've announced a campus fellow program. Here we are at UCLA. We hope that we get a lot of applicants from UCLA, as well as other University of California campuses, Cal State's community college, and private campuses throughout the state. What we hope to do is to provide the kinds of tools to enable young people to make good on what they already know and what they already believe and what they're already trying to achieve. Is a dream of a California that is much better than what we have today, and one that finally fulfills the promises of California, of being a state of inclusion and a state of innovation. People have asked us what the 100 in California 100 means. One way to think about it is 100 years, right? We're talking about the next century. And for a lot of people, myself included, when we got started in this work, it's challenging to do. It hurts your brain a little bit to be thinking that far ahead. At the same time, this is not that new. I was reminded when speaking with our now Commissioner Geneva Wiki from the Yurok tribe in Northern California, that the kind of intergenerational work that we are embarking on is something that the Yurok have done for centuries, much before there was a California. In fact, you have peoples in California that are thinking in 500-year timescales, not 100-year timescales. So it's important as we think about long-term futures to also recognize our past and our history. So as we're here in Los Angeles, it's important to recognize the past, including the trauma, as well as the resilience and vibrancy of the Gabrielino and Tongva peoples that still call Southern California their home. Now, before we get to the reports and the amazing work of our research partners, I just want to give a few words of thanks. So all of us at California 100 are grateful to the research partners that you see today, as well as to the Institute for the Future for their support and thought partnership in this work. We're also extremely grateful to the University of California, and especially the Goldman School of Public Policy at UC Berkeley, Stanford University and its Institute for Economic and Policy Research for believing in us and supporting us through all of this work. Deep gratitude in particular to Henry Brady, our Director of Research, who isn't with us today but is watching us remotely, as well as Lindsay Maple, our Deputy Director of Research, who've worked tirelessly to help bring these research reports to fruition. And what you'll see today is these are not your standard set of research reports. I think it's safe to say for all of our research partners, we were doing things that our researchers had not done before. And we hope that by stretching and flexing, that we're able to build a new kind of research capacity in the policy-oriented, community-oriented, and applied work that you'll hear about today. So I want to give a special thanks to Griselda Melgoza, who is our Public Affairs Associate, has worked tirelessly behind the scenes to make sure that this event goes off without a hitch. So let me just conclude there for now. There's a lot more to say. I'll be the moderator this evening, but first I want to welcome our hometown superstar, if you will, Ninez Ponce, the director of the Center for Health Policy Research, and the research lead in our policy report, in our issue report on health and wellness. Ninez.
Go Bruins. So thank you, California 100 team, especially Karthik Ramakrishnan, Henry Brady, and to Lindsay for inspiring this futurist frame in health policy. And a shout out to the health and wellness team from the UCLA Center for Health Policy Research. This was an all-center project relying on our entire policy analyst bench and most importantly, the valuable feedback from a legion of community partners. We are a center, actually, that does deal with the past, the present, and the future. For the past, with our health economics and evaluation research program that evaluates big Medi-Cal health system delivery innovations. For the present, with the California Health Interview Survey, an annual survey that paints a picture of the health and healthcare needs and well-being of the state's large and diverse population. And we project the future through our California Simulation of Insurance Markets program in forecasting the effects of policies such as increasing premium subsidies for people directly purchasing health insurance through Covered California, our state's health insurance exchange. But Karthik, we and Henry out there, we have never been tasked with imagining a future beyond the contours of the current health system, nor has the far-sighted gaze been cast so far out beyond the next year, beyond the next state and presidential election, even beyond the next 10 years. 100 years in 100 days, I say, this report. So what's our report card for California's health and well-being? Well, it's alive, but it's not thriving. It is safe to say that all Californians dream of a cleaner, safer, less costly, more connected, and happier state. The health and well-being of all is not only influenced by access to health care and healthcare services, but by the conditions in which we live, the cost of living, the poverty, the access and quality of our schools, the degree of social support, safe and accessible public spaces, and level of environmental pollutants that we hope would not harm our children. So collectively referred to as the social and structural determinants of health. But the first dictum in any health and well-being study, whether now or 100 years, is having health insurance coverage that gives you access to quality health care regardless of your ability to pay. California has indeed cut in half the uninsured rate in the last decade to 8% since the passage of the Affordable Care Act, and is poised to further reduce it through past and current legislation that has expanded Medi-Cal to segments of immigrants in our state, regardless of documentation status, and California has led the way across the nation. While these expansions are chiseling away at the uninsured rate, if we had headlines in our report, here they are, and that's not all of them. Latinos still lag behind all other groups in health insurance coverage. High proportions of California's Asian and Black African American adults reported being treated unfairly because of race ethnicity due to the COVID-19 pandemic. Mental health issues, no surprise, are rising, but especially for our younger Californians and our older Californians. And LGBTQ plus communities have higher rates of mental health needs than the general population. And did you know that California has the highest proportion of children living in households burdened by the highest housing costs than any other state? And this is driven by the fact that California has the highest child poverty rate in the nation. It's no wonder that food insecurity, not having regular access, not being able to afford food when you are hungry, has been increasing since 2017 for children and for young adults. So what could be our children's and their grandchildren's, our great-grandchildren's, our nieces? What do we look forward for them for their future? We looked at 4 scenarios based on whether we want to see our health widely or narrowly defined, and whether we operate in silos or in more connected, interoperable systems. Interoperable meaning it's not just about computers talking to each other, it's about people, the agents of your care talking to each other, the agents of health and wellness, your doctor, your child's teacher, your mother's caregiver. They talk to each other and share information to coordinate in getting you or your family member the health and support services that you need. I will describe 2 extreme scenarios here. There were 4. But the first is a very siloed sickness system. In this scenario, healthcare is oriented toward providing care primarily to the sick, or when you get sick, operating from a narrow definition of wellness with very few efforts made towards integration across the various sources of care and help that you need. If California political taste leads to more individualistic attitudes towards health, more personalized attitudes, then this could be our future. Or we could be in the scenario of uniform health and wellness. In this future, health and wellness is defined more broadly, and healthcare is highly integrated with social needs such as housing and education are included. So our prognosis: the future signals bode well with this more community-oriented, integrated scenario. One of the signals is the recent launch of CalAIM, California Advancing and Innovating Medi-Cal. CalAIM boldly plans to increase whole person health beyond clinic walls, building on top of existing programs and creating new data sharing pathways between them. So while the focus is only on the Medi-Cal program and its 5-year program, the impact is for over a quarter of the state's population. So our team certainly is banking on CalAIM's success to inspire a future of health in all, for all. This will get us closer in realizing the dream of securing the best possible health and well-being of Californians, and we may get there sooner than 100 years.
Thank you, Ninez. As you can tell, there's not only reams of rigorous research that is underlying what Ninez just presented on behalf of her team. There's also creativity, there's imagination, there's deep engagement. One of the things you'll see in the report, and this is true for all of the reports that we have, wasn't just something that was cooked up in a university setting. There was deep community and stakeholder engagement in the work, and we're just so tremendously proud, Ninez, of the work that you and your team have put together. Next, I'd like to welcome Charis Kubrin from University of California, Irvine, who co-authored the report on the future of criminal justice reform. Charis.
Good evening, everyone. Not to be outdone by the previous speaker, representing UCI, zot, zot, zot. So I would like to echo my thanks to the Cal 100 team, who have been really fantastic to work with, all of them, and have really pushed my and my collaborators' thinking along the way. It's been a real privilege and honor. And I also want to acknowledge my collaborator on the project, Dr. Bradley Bartos, who's at the University of Arizona and who is watching online. And I want to start off by saying, perhaps more than any other state in the United States, California is in a period of fundamental reform to its criminal justice system. It's really at the apex of states in criminal justice reform. Since 2011, the state passed a series of reforms, most of which were intended to reduce its massive prison population, and they did. The COVID-19 pandemic furthered California's trend in decarceration as the state reduced jail and prison populations to slow the spread of the virus. In fact, efforts to limit the spread of COVID-19 reduced the state's correctional populations more steeply and abruptly than any contemporary criminal justice reform passed prior. As I stand here today, California's incarcerated population is at its lowest level in 30 years. Now, importantly, these significant reforms and prison downsizing more generally have not harmed public safety. While some types of crime did increase during the pandemic, overall crime rates remain at historic lows, and this is true for both violent and property crime. So as you can see, when it comes to public safety and criminal justice reform, California has done many things right, and we detail all of this in the report. But it has also fallen short. Corrections spending has not tracked with population declines, and correctional costs remain very high in the state. In fact, California's total spending on corrections now approaches the state's total spending on education. And, depressingly, a year of college in the UC system costs significantly less than a year behind bars. Despite this spending, crime rates have not fallen proportionately, suggesting that the state is reaping diminishing crime control returns on its incarceration investments. On top of that, racial inequality in California's criminal justice system persists. While earlier reforms did reduce the disparities somewhat, these changes do not rise to the level of the current national calls for reform, which explicitly seek to combat anti-Black racism in our criminal justice system, and especially in policing. At the moment, California ranks 8th in the nation in terms of in the U.S. in terms of Black-white disparity in incarceration rates. Latinos and Latinas are also overrepresented in the correctional population, although to a lesser degree than African Americans. The big question now, of course, is what's next? And in our report, we argue California is simply at a crossroads. We envision 4 scenarios for California's future, which vary along 2 critical dimensions. The first dimension, what we call economic and organizational pressures, considers fiscal constraints and the ability to introduce new public expenditures in the state. One end of the spectrum represents economic contraction and scarcity, which I think has defined the state, at least in criminal justice terms, for the last several years, while the other end represents economic expansion and budget surplus. The second dimension, perceptions of crime, reflects the extent to which the public, rightly or wrongly, fears crime and how elected officials politicize crime and criminal justice policy up and down the state. One end of the spectrum is defined by the public's acute fear of crime, resulting in an electoral incentive to get tough on crime, a phrase we've all heard over the years. The other end of the spectrum is defined by the absence of a moral panic about crime and the public's further desire for criminal justice reform, resulting in an electoral incentive to appear smart on crime. Briefly describe 2 scenarios at the extremes. One scenario at the extreme, what we call mass incarceration redux, reverses course on the reforms of the past decade. So basically wipes away all of the progress that has been made and that we detail in the report. Just as rising crime rates led to public support for the war on drugs, the past decade of reform coupled with historically low crime rates, could make voters more sensitive and reactionary to any future crime increases. Whether driven by real or merely perceived public safety concerns, if a fear of crime threatens the election prospects of the political left, the party may encounter an if you can't beat 'em, join 'em approach, similar to what occurred following the 1988 presidential election. The result is a massive increase in the incarcerated population, the need for new prison construction, and skyrocketing criminal justice costs throughout the state. Racial disparities are also expected to increase. Now, in another scenario at the other extreme, what we're calling reimagining corrections, a strong economy and budget surplus combine with political will and voter appetite to significantly reform the remaining criminogenic aspects of California's criminal justice system, essentially reinvigorating interest in the rehabilitative ideal that dominated in the late 1800s and early 1900s. Rather than reactively rely on incarceration rates, this scenario seeks to eliminate the underlying structural factors that produce crime in the first place: poverty, inequality, joblessness, so on and so forth. And in the extreme, could generate efforts to completely overhaul California's criminal justice system as we know it. Two other scenarios fall somewhere in between. The question I want to leave us with today is, which path will California choose? We argue it's a critical question, not least because when it comes to criminal justice, as California goes, so goes the rest of the nation. Thank you.
Thank you, Charis. And one of the questions we'll hopefully get to in the Q&A is the tension in terms of short-term dynamics, especially those that involve elections, and the kind of incentives that are built in there to get people to react and maybe get political mileage out of these short-term dynamics that may ultimately be harmful in the long run. Thank you, Charis, for laying it out so succinctly and crisply. I talked earlier about how we're bringing Cal and Stanford together. Today we're bringing USC and UCLA together. Manuel Pastor, who's a professor at USC, complained a little bit about traffic, I think, on the way to the west side. Manuel is a tremendous resource and asset in many areas, including regional equity and immigrant integration. Thrilled to have him and Tyler, who authored this report, and again, working intensively with community and policy partners in crafting the scenarios that you'll hear about, and to think about a future of immigrant California that might look quite different from what we've been used to in the last few years, and certainly even in the last 30 years. Manuel.
Thank you, Karthik. And yeah, I'm Manuel Pastor from the scandal-plagued University of Southern California. But both my kids went to school at UCLA because they knew that would drive up the tuition costs. And this means that I at least have a visitor visa when I'm here. So California is often thought of as an immigrant-rich state, and there's good reason for that. A quarter of our population is foreign-born, a third of our workforce is immigrant, about half of our children have at least one immigrant parent. And certainly we were the place that immigrants came. In the 1970s and in the 1980s, fully half of all the immigrants coming into the United States settled in California. Now, that period actually produced a xenophobic reaction in the form of the passage of Proposition 187, the proposition that sought to deny health care, education, and all sorts of social services to undocumented immigrants. But from that abyss of hate, we now proudly term ourselves a sanctuary state, an event fueled by immigrant organizing, Latino and Asian political leaders, and a sea change in the business community. so much that Karthik Ramakrishnan has talked about de facto citizenship. And we've heard about being on the cusp of extending health insurance to all in the state of California. But what that means is that California is sometimes so proud of itself. There's a great expression in Spanish, se cree muy muy, which means you're conceited. Literally, it's he believes himself to be very, very. That California se cree muy muy. We are so progressive that we haven't noticed that the share of the population that's foreign-born is shrinking and has been for several years, that we've got the most settled immigrant population in the United States, meaning there are new people coming in. In fact, 2/3 of our undocumented have been here for more than a decade. And our task is trying to understand why it is immigrants are no longer coming here in such numbers and moving elsewhere rather than here. And our task is going to be managing the successful integration of immigrants who are here and attracting new ones in the future for reasons I'll explain. In order to get at that, we need to look at 3 trends: changing composition, demographic change, and economic transformations. So first, changing composition. In the year 2000, about half of all of the immigrants who'd come into California in the previous 2 years were from Mexico. That number now is 16%. People aren't coming from Mexico, they're coming from Central America and then from Asia. Those who are coming from Central America are fleeing climate change, economic dislocation, and a tremendous political crisis. And what does that mean? We were blessed in the past with Mexican immigrants who are coming ready to work. We now have immigrants coming who are essentially refugees who need a lot of support. And from the Asian countries, we've got a very bifurcated population. The romanticization of people who are high skill and high wage, but we also have a lot of people who are entering in at the bottom of the labor market and who also need support. Demographically, we always look to the past, and we understand that we have become majority people of color, and we imagine that that demographic change in terms of our racial hue will continue to change. But that's not so. We are currently 62% people of color. 40 years from now, we'll be 66% people of color. If you want to look at what we look like ethnically, look at today. But one thing is true, is that we're all going to get older. People, when they think about the population getting older, they think about the white population. But here's the secret. Each year, Asians and Latinos also get 1 year older. And if you look at the median age of white people in the state of California, it's actually going to drop slightly in the next 40 years. But the median age of Asians will rise from 42 to 48. The median age of Latinos will rise from 29 to 42. That means that if we have the current racial wealth gap and we think about a population getting older, we're building in more dependency into the future unless we address this. Finally, economic transformation. The only thing I will say about this before talking about the scenarios is that California needs to wake up to the fact that while we think about our economy as being based in biotech and high tech and all of those fancy sectors, behind every software engineer or bioscientist is an army of nannies and food service workers and gardeners. And our economy is both high skill and high wage, and it's actually high skill at the bottom. It's tough to take care of your kids. It's tough to be a food service worker, but it's not well rewarded. And unless we begin to lift up the bottom for everyone, we'll have problems in the future. So what are the scenarios that we project going forward? One is all talk, no action. That is that California will continue to talk a good game, but it won't address the fundamental issues of economic inequality and housing that are pushing immigrants away. For immigrants in this state, they are having to make a choice between, do you want to be in a place where people say nice things about you? Or do you want to move to Texas where people might, I was about to say talk shit. Can we do that? People might say bad things, but you could actually buy a house. We could have a scenario of invasion and reaction. That is, lots of needy immigrants who are coming to the state or simply aging in the state without proper support, creating fiscal stress and feeding into xenophobia. We might have nativism and decline. That is the kind of tribalism, in the negative sense, that's been emerging in the United States, and by pushing away of the immigrants we need for our economy, so it decline. Or we could have a scenario that we think is much better. We are California. And that is where the welcoming tone is coupled with real policy change and a commitment to asset building for immigrants, to building inclusive institutions where immigrants can express their needs, and a growing up of Californians to the realization that all labor is valuable and needs to be supported. You can tell which of those scenarios I think is best. And I hope that we begin to understand that what is good for immigrants is good for California, and the future of California is intimately connected to not just immigrant integration, but immigrant inclusion in our economy, in our decision making, and in our civic life.
Thank you so much, Manuel. We'll stick with the immigrant inclusion theme, and I'll turn to Cynthia Buiza, who's the executive director of the California Immigrant Policy Center and one of our 26 commissioners. Cynthia, not just hearing Manuel's remarks, but the research that Manuel and Ty put together, what are some kind of big ideas? I mean, you've been in this space for a while, so I don't think you're easily impressed or surprised with things. But what stood out to you when you read the report?
Absolutely. Thank you, Karthik and California 100 for bringing us together in this very important gathering. I usually tell my friends that I feel as old as dirt when it comes to being part of the immigrant rights movement. But actually, I wanted to do justice to this very complex report that Manuel and his team put together and put on some thoughts in response to the findings. I'd say at the outset that it's mystifying to think that as far as immigration is concerned, it's like quoting Shakespeare, past is prologue. If you think about the last 100 years, with public charge and the Chinese Exclusion Act, immigration in this country seems to move in circles. At the same time, we've also lived through some variations of these scenarios in the last few years. Certainly under Trump, some of those worst case scenarios that Manuel pointed out, we have gone through them. So the question of the future of the next 100 years in California as far as immigrant inclusion is concerned, so I'm using the term inclusion rather than integration, if you'll notice, is a question of three things: resilient infrastructures, robust immigrant political power, and the ability to address the root causes of immigrant inequities, including fixing our national immigration system. The best case scenario identified in the report rightly points out that we have, as a state, consistently moved in a positive direction. We are not yet in the golden age of policy making, as it were, but we're not doing badly. The constellation of affirmative policies, everything from undocumented drivers being able to drive, healthcare access, access to legal representation, and now we're even talking about some type of unemployment insurance for excluded workers. These are great policies that need to stay permanent. because the challenge before us is how to maintain the momentum in this direction and make sure that we have answers to some of the challenges that Manuel points out in his report. You know, the evolving nature of migration flows, complicated by climate-induced migration, as well as intractable global conflicts. This also includes our widening inequality in the state, our dark divide over the conversation on race, will collide with the fact, and this I want to emphasize, that immigrant inclusion remains at the periphery of nation building and state building rather than an integral part of it. So I want to conclude my response by saying that our future immigrant inclusion agenda should focus on building, sustaining, and maintaining a resilient infrastructure, because that is the only way to mobilize immigrant power and create a foil against shifting political winds and public attitudes, also pointed out in the report. This means, however, addressing some core issues today, because we can't get to the next 100 years without addressing the problems of today. There is no real lasting immigrant inclusion without addressing fundamental human needs of immigrants: healthcare, shelter, food, safety, a sense of real community, and making them permanent first. We can make these practical, comprehensive solutions that's pointed out in the report, including addressing gaps in worker rights and workforce training, language access, housing, education, and the digital divide. But we gotta start with those fundamental human security requirements to be able to get to those other visions. The ability of the state to maintain this warmth of welcome will determine where we go as a state and where we go as a country. And I want to say that I really look forward to using these reports, because they're amazing analytical tools that policy advocates like myself and my colleagues will be able to use in our work. And at the same time, you know, help us to become smarter in dreaming our immigrant dreams and also making them a reality in the future. Thank you.
Thank you so much, Cynthia. Next, we have Jeffrey Reynoso, who is another one of our commissioners on the health and wellness track. Jeff, when you heard Ninez's presentation, read the report, initial thoughts and reactions, as well as drawing on your own expertise in the health and wellness space, would love to hear your thoughts.
Sure, thanks, Karthik. And as I was walking on campus, thinking about the multi-generational aspect of California 100, Ninez was actually my first boss out of undergrad at UCLA, so I'm definitely feeling the multi-generational nature here. I want to thank the UCLA Center for Health Policy Research, and I know the hard work that went into the report, and I think it's a great foundational report that I feel we need to give to every medical student, school public health student, public policy student in the state of California, so I hope we share more widely. I'm going to focus my remarks on the health and wellness issue report and maybe touch upon some of the themes with immigrant integration and with criminal justice reform. I think generally most of us that are in the health equity or the public health space would agree with the conclusion of the scenario that we need a broad definition of health and wellness, and we need better connection, interoperability between systems and connection. So, I hope to provide some additional context and color and maybe a broader landscape to some of the remarks laid out in the report. So just wanted to focus, and as you hit it on the head, focusing on the healthcare coverage piece. The Affordable Care Act, the promise of the Affordable Care Act got us to a better place in the state of California, reducing our uninsurance rate by half. But at a federal level, there was one group that was left out intentionally in the making of the law, and those were undocumented immigrants, right? In my day job as executive director for the Latino Coalition for Healthy California, we're a founding steering committee member of the Health for All campaign, co-chaired by our fearless champions at CIPC and Health Access. And we've expanded coverage in the state of California. We said, we got this far, but we need to ensure that Health for All means everybody in the state. And there have been some incredible expansions to kids and young adults and those ages 50 and up. This year in the governor's January budget, there was a proposal to ensure that all, regardless of age. So we hope to get there with the final budget negotiations. I think one of the things that I'll highlight from kind of a policy implementation perspective that we find, particularly with Latino communities, other communities of color, limited English proficient communities, is you need to pass the policy and then you need to administratively actually make sure that folks sign up for coverage. And that's really the hard challenge in the state as geographically diverse as California, as ethnically and linguistically diverse. And so we've done a lot of work at our organization to really think about the implementation piece and ensuring that our communities are informed about the coverage expansions. But again, this is in the context of, at a federal level under the prior administration, policies like public charge, which created a chilling effect in immigrant communities. And so we're having to combat that chilling effect to ensure that folks feel that they can sign up for a government service like Medi-Cal. So, I think as we think about ensuring that there's coverage and everyone is covered, the next kind of step that we find in communities is that healthcare affordable, right? So we actually have produced a series of focus groups of Latino communities across California for the last several years, different regions, and what we find is the top issue, just to add a little bit to this, we have, as the report elevated, we have different payers. We have a multi-payer system. We have employers paying for healthcare. We have the public sector paying for healthcare, individuals paying for healthcare. It's a really complicated system. I think one of the things that I'd like to highlight is the ongoing conversations at the state level with the Healthy California for All Commission. So a lot of work has been done over the last 2.5 years. This was established by SB 104, and really the charge of the commission was to develop a plan for the state of California of a unified financing system in California. So really making it one unified system that we would all of these multiple payers would have to pay into, and making it, I think, a more streamlined system. I think if anyone watched any of the commission meetings, a lot of spirited debate and conversation. I think among the commissioners in terms of what this type of system may look like for California. But I think being a health advocate, oftentimes when I think in academia or those of us that have formal positions of power in the healthcare sector, I always try to remind myself about who we're trying to serve, right? And it's the community, it's Californians themselves. And so I want to highlight one of the elements of the report. So there are 3 commissioners that are heads of major foundations, health foundations in the state of California, the California Endowment, California Healthcare Foundation, and the CCF, the California Community Foundation. They commissioned a report called Community Voices about a year ago, and they surveyed 2,000 Californians. It was representative of geography, language, culture, and what Californians said is they want a simpler healthcare system. They want a system that is less costly. They want a system that meets their linguistic and cultural needs. And so I think earlier today, actually this morning, the commission voted on the final report. And I think one of the I think the kind of blockbuster findings of the report that I wanted to highlight is absent of a shift in unified financing, aggregate healthcare spending in California is estimated to increase by $158 billion in 2022 dollars in over 9 years. So the healthcare spending growth is enormous. So unless we, really move fundamentally in shifting some of the financing issues, we're not going to get to broader health equity in our system. Now,
We'll come back.
Sure, go for it.
But this is actually a good pivot, because it sounds like if we're kind of staring down this kind of fiscal nightmare, Charis, I mean, that's where California was when it decided to do criminal justice reform in a big way. I mean, Jerry Brown was not he was former attorney general. He was an unlikely reformer, I would say. I mean, he had some elements of that in his past, but it just didn't pencil out financially anymore to continuing to incarcerate our way into safety. But in this report, you say that we may see a return to mass incarceration. I mean, right now, you're seeing that we're at historical lows, but there's a lot of, it seems like crime is popping up as an issue. There are a bunch of politicians from local to national offices congressional offices that are running on that platform. So it doesn't seem kind of that out of the realm of possibility. But there's another scenario you had in which even if we don't pay a ton of money, we could still punish our way into public safety. I don't know what the social science says of how enduring that can be as a solution. Can you just say a bit more about kind of what Jeff is kind of sketching out is, you might need to fundamentally, if not tear down big pieces of the system and rebuild. Think of some, I hate to say this with health, like some major surgery rather than like minor surgery, right? In terms of what that future looks like.
Yeah.
So thoughts about that?
Unfortunately, that is an absolute potential path, especially as we see, midterm elections coming up, the ramping up of the politicization of crime. I was just thinking about different groups that we could be scapegoating in the future. Immigrants are always right at the front of that list. And the unhoused, those with mental health issues, right? So there's a lot of potential politicization going on. The question is, can the state afford to do what it did, which got us in trouble in the first place, which is construct prisons, house people in enormous overcrowding situations for years. And basically the state went bankrupt. And so I think that is no longer a feasible option. So one solution to that is finding ways to manage state populations without expanding our prisons. And one way to do that is to expand our jails, which are less costly. Another way to do that is to use technology to better manage our populations, our correctional populations. We're already doing that to some degree. Community supervision, electronic monitoring kinds of things. Privatization is a creeping concern, right? As we start, particularly with immigrants and looking at detention. I know it's not a surprise to folks up here that a lot of that is private corrections. So that's a concern that we have, is that in fact either crime rates will rise or there will be a perception that they're rising at an unsustainable growth. New scapegoated populations will be identified and the state will incarcerate at high rates and find ways to do that cost effectively. Not a good solution.
So let me turn to my neighbor here, Ninez. Ninez, there's a lot in this report. One of the things I found fascinating was this notion that where some of the early innovation is happening in California, you talked about CalAIM, that's in the public system and not in the private system. Usually we think of innovation as happening fastest in the private sector, although when Amazon and a bunch of others tried to disrupt health insurance and healthcare, it didn't go that well. So can you say more about CalAIM and what it's trying to do, and like what could that look like in the future if we take the lessons from that? How do we take that over into this fragmented system that Jeff is talking about?
Yeah, I think when we think of innovations, like in the private sector, it's very, again, individualized. I think I said this. So it's individualized reporting from your Apple Watch. It's individualized, like the tech of actually this particular person's need versus a more or less community view. And the public sector has that innovative role to really get at the community level needs. But it's also cost, as Jeff said. I mean, a few years ago, it was 1 in 3 were in Medi-Cal. It's a huge population. And you don't want recurring ER visits. You don't want to lapse into being unhoused. It's very expensive. So it's actually, I think it's actually the cost signals that led to some of the government innovations. But in addition to, of course, this value of a public good, like a value of trying to get at the community.
Well, you also can't pass the buck, right? If you're ultimately the state
can't,
government
exactly. Yeah.
that's going to be paying for something, if not in
Right,
an emergency room, but
who's
in
going
a
to
homeless
pick them,
shelter.
Yeah, who's
et
going to
cetera.
pick up,
Right.
I mean, there's also some scathing, op-eds that UCLA does not see Medicaid patients, right? So, it's who's going to be the safety net.
Excellent. Manuel, down to the end there. So thinking about this aging California, and to think of a California that even if we patted ourselves on the back and did all these things that are not only of symbolic value, but really when we talk about important measures of political rights and social rights that we advance there, but ultimately it's a really expensive place to live. I think you've said this, but I'd love for you to dig in more in terms of thinking of housing policy as immigration policy, if you will, right? And Cynthia talked about broadband policy as immigrant inclusion policy. Can you say a little bit more about that in terms of going way beyond just political and social rights that we traditionally think of as immigrant policy?
And incarceration policy is immigrant policy. So I think it was 13 research areas, and all of them touch on immigrants. Immigrants are heavy users of transit. Immigrant voters are actually more pro-environmental than white voters in the state. So climate change also at risk. So I think that it behooves the state to think about immigrant integration and inclusion not as a kind of isolated piece to be done, but where do we need to fire on all the different parts? And it also means that groups like CIPC, California Immigrant Policy Center, are moving into, with the last contributions report we all did together, the big issue was housing, because that's really what's chasing immigrants away and actually damaging their lives. So I think there's an opportunity here to cast a wider vision, and it's necessary. But it's going to require new muscles for all of us. The point I was trying to make is when we're an immigrant-rich state, you forget about competing for immigrants. When you spent your time defending undocumented immigrants, you forget about, well, how do we make sure that folks with green cards find paths to mobility? When you think about Latino and Asian politicians being on your side, you forget that some second-generation politicians might become nativists themselves because they're worried about resources being taken away. And then the biggest thing, when we've all talked about the aging of America, we keep thinking about white senior citizens and people of color, forgetting that people of color will actually get old too as we move forward into the future. So I think the big thing, and really, Karthik, I would like to congratulate California 100 in general for doing this, which is to say we need a different set of muscles to move forward in order, and we need to exercise those to be able to really land a better future.
Thank you, Manuel. So let me dig into this question that I teed up with Charis before, but opening up to everyone. Is this notion of what might make sense in the short term might be terrible policy in the long term? And yet we live in these short-term realities of political cycles, of quarterly, with public companies, with quarterly statements, et cetera. that kind of accountability. I mean, Jeff, when you talked about this other commission that says the way that if we keep patching our way to getting to full coverage, at some point it's going to be really, really expensive and unsustainable. But it seems like we, certainly on climate change, but on a bunch of other issues, we wait until it's almost too late and then rapidly try to have these transformative solutions. But is there any way out of that? Like how, I wonder if there's something beyond our institutions and the way they're designed, just the way that our modern society is built, that makes it really difficult to do those big transformations. Someone please tell me I'm wrong and show me a path that's different.
I think you're right. I think just to add, I guess one illustrative example that kind of speaks to this, under the CalAIM proposal, and there was it's huge sea change in Medi-Cal, and why Medi-Cal is so important. Someone may have to check the citation on this, but I believe Medi-Cal's spending is higher than the entire state of Florida, if I'm not mistaken, just one program within the state of California. I think one of the innovations in Medi-Cal that we haven't talked a lot about just in the public arena has been the integration with the justice-involved population. So there are some innovations in the CalAIM proposal to ensure that folks that are going back into the community, they've served their sentence, are going back into the community, a recognition that this population is more likely to have some substance use disorders, mental health, behavioral health issues. In CalAIM, we're going to start actually getting folks covered under Medi-Cal before they're released. So starting the process before they even leave the jail or the prison. Secondly, once they're in the community, actually there's an investment in what they're calling community supports. I'm forgetting the other one right now, but community supports, but essentially ensuring that there's a care coordinator that's able to support the individual once they go into the community. And so what this is involving at a county level, who are the implementers of this particular provision in Medi-Cal, is that county healthcare services has to talk to the sheriff's office, right? You have to build that into the system. You almost have to build multi-sector partnerships and build that muscle, but you have to actually write it into the policy in the implementation. So I think the future, at least when in the healthcare arena of how we're going to solve some of these complex challenges, is ensuring that there's multi-sector coordination and that we're talking to folks outside of the healthcare system.
Well, go ahead, Charis. Sure.
To that. So in terms of answering your question, if you're looking at California's past with respect to criminal justice reform, not optimistic, because as you mentioned, all of the reforms that we've seen in the past decade are literally due to fiscal crises, the Supreme Court stepping in Brown v. Plata saying if you do not get your state prison population down by 133,000 people in 2 years, you're in big trouble, and then the COVID crisis in our prisons. However, I do want to end on an optimistic note here. Looking forward, there is room for optimism because Prop 20, which was introduced a year ago or so, which sought to roll back all of these reforms, was voted down by California voters last November. And so California voters recognize that going back to where we were is not a solution, and they are actively voting against rolling back reforms. That's cause for optimism. So I think California residents have a lot to say about this, and they are saying it by voting. And so that's a bright light there.
Manuel?
So I am by nature optimistic. I'm the kind of person who can walk into a room full of manure and say, wow, there must have been a pony here. I'd like to remind us that California in the 50s and in the 60s made a commitment to investing in human capital through the master plan, made a commitment to investing in infrastructure around energy and water and housing, and all of that reflected an intergenerational compact and a willingness to welcome people, mostly from other states. That compact unraveled basically because of racism. That as the state changed demographically, as more people wanted into the California promise, the drawbridges were lifted, investments dropped in infrastructure, in housing, not in my backyard, and in education. So our fundamental challenge with thinking long term is combating the racism and xenophobia that divides people and prevents us from seeing all of us as belonging together and worthy of investments in our California.
So, yeah, go ahead, Cynthia.
I'm going to say something provocative because this was elicited by one of the responses from the commissioners in the previous launch. Her answer to one of the transportation reports was our ability to develop the muscle for both and. You know, the future is happening as a consequence of the actions we do now. So it's possible to fix our healthcare system while including undocumented immigrants. It's possible to give more money to housing by looking at some of the gaps that exist for immigrants who are houseless. So it's that muscle of actually doing these things, just juggling acts that need to become real in our public policy, in the way we do programming at the county and the state level. I think that if we can turn these both and strategies into something real in the public sphere, we will get closer to that idea of building a different muscle rather than destroying infrastructures that are already working.
So let me toss one final question, which is, we have federalism as one of our issue areas, and we'll be releasing a report on that, federalism and foreign policy on June 1st. Thinking specifically about healthcare and immigrant inclusion, but also about criminal justice reform, it seems like California is starting to hit some limits in terms of what it can do, even with a Democrat in the White House. So what should we be thinking about? Although Ninez, I think certainly with Medi-Cal is the state's implementation of Medicaid, it seems that there's still kind of room for innovation there. But do you worry about some of the limits we will hit if we don't have a favorable federal environment?
Well, the Medicaid program is, again, a federal state program, and the CalAIM innovations require waivers and approvals from the Centers for Medicare and Medicaid Services. And it's funny, I came here with very bullish about health, and after hearing everyone speak, I'm like, oh no, I'm not sure, just because I think the question is, so the federal piece, there was a time when we were thinking, should California secede? Like, could we do things, on our own? Because it's yes, right? Me. But
well, we technically cannot.
But we can.
Yeah.
We technically cannot, and there's just too much federal money coming in the healthcare system in terms of the match and the infrastructure for community health centers, which is a safety net, in the safety net hospitals that get disproportionate share, funding, hospital. So it's, we can't do that. So the federal government, like it or not, feeds us. So we do have to worry about a new administration, or they think we shouldn't be doing this innovation. So there's definitely, a concern. However, because our economy goes up and down, we have a surplus, and I think it's the surpluses that led to, well, why don't we share with everyone? And the other sea change is COVID for public health. Yeah. So that was the other sea change. So we're all like, why deny vaccines? Why require a photo ID to get a vaccine when you can actually protect everyone? So I think this notion of externalities, in healthcare, I think that it really got to some people. Maybe it's waning. I think there's a little bit of fatigue going on with the pandemic, but I think it helped us think about what's public health, and that protecting all people is going to protect you.
To add two things to that. One, just pure advertisement. Every one of these reports also has a facts, origins, trends report. And I would be remiss if I didn't add that my colleague Tylay, the lead author on both this and the facts, origins, trends, drove our team to produce, I think, 78 different charts. So can you please reward my overachieving staff by actually reading that other report as well? But Karthik, I think one thing I've been thinking a lot about, and you're probably the most interesting person I know to comment on this, is what's the difference between a federal strategy and a national strategy? Because federal is DC and national is state by state. We would not get the administration we've got in DC right now had there not been a state strategy in Georgia to transform the politics in that state. And apparently with what's going on in Florida, Fresno now has a chance to attract Disney World to move over for a tax abatement. So one of the things I think is really important for us to be thinking about is these state-by-state variations and experiments and what they demonstrate to different states about whether de-incarceration actually does pay off, about whether including everyone in our healthcare system actually protects all of us, how immigrants can contribute. I think it's really important for California to set an example and for California to find other state allies, because that's what's going to change federal policy, not the games in DC.
Yeah, absolutely. One final thing I'll wrap up with, and this has come up a few times. I think I've found at least part of an answer of how do you get beyond some of these kind of short-term pressures and think bigger and longer. And Cynthia, you talked about infrastructure and this more expansive notion of infrastructure. That is an issue in which we know that the returns on that investment doesn't happen right away. And yet if you don't invest in it, you're going to be in really bad shape. So that's something that'll stick with me. And also, Manuel, when you talked about capital, and I know that this is, with some of the work you've done in terms of reimagining capitalism, but yeah, let's think about this broader, much bigger notion of capital and the need to invest in our human capital and our social capital, and to be very clear about the kind of disparities that we have right now. I mean, there's a lot that is going well in California. There's also a lot in California that has to be fixed. And if you don't fix those capital disparities, you're talking about generations of disadvantage that we will propagate. So I think that helps answer the question, why us and why now? Because if we don't act, we are going to be complicit in reproducing those kinds of inequalities in the future. Well, I want to thank you all for joining us here in person today. We're just getting started with California 100. We have more reports coming down the pike, but also significant engagement, including tomorrow at USC. We have Cynthia who's going to be joining us again, as well as folks in state government. And we're hoping that these are not only opportunities for us to think more creatively, think bigger, but to actually start taking action. We hope you'll join us in this journey. Thank you, everyone, for being here today and joining us online.